Hello, everyone. Welcome to Life After 60, where we share tips on how to stay healthy and active even after crossing the threshold of 60. Did you know that as we age, our bodies begin to change significantly, especially in terms of bone and joint health? Bone and joint problems are a natural part of the aging process, but that doesn't mean we have to accept them passively. On the contrary, with proper understanding and reasonable preventive measures, we can absolutely maintain flexibility and mobility even as we age. In today's video, we will explore 5 common bone and joint issues that the elderly often face through real-life stories, lessons learned from many people's experiences, and helpful solutions to protect long-term bone and joint health. Let's begin the journey of caring for our bones and joints life after 60. Stiff joints. Stiff joints are a very common issue that elderly people often face. When the joints lose flexibility, we experience difficulty with basic daily movements like bending down, turning, or standing up from a chair. This condition not only hinders movement, but also affects the quality of life and independence of the elderly. Let's hear the story of Linda, a 69-year-old woman from Australia. Linda has always loved gardening and baking. Her whole life has been dedicated to hands-on tasks, and she has always felt satisfied being able to take care of everything around the house. However, as she entered her 60s, Linda started noticing changes in her body. Every morning, she felt stiffness in her knee and back joints. Particularly when bending down to garden or bake, she experienced an uncomfortable, aching pain. Initially, she thought this was a normal sign of aging, but the condition gradually worsened. One morning, when she tried to bend down to pick up a fallen leaf, she couldn't stand up right away. That was when Linda realized that stiff joints were not something she could ignore. She decided to visit the doctor and was diagnosed with joint stiffness, a condition where the joints lose flexibility, causing stiffness and pain when moving. The doctor explained that this is a natural part of the aging process, but if not treated and cared for in time, it could lead to reduced mobility, even loss of the ability to care for oneself. After receiving advice from the doctor, Linda started attending gentle yoga classes and doing muscle stretching exercises. She also paid more attention to balance and improving her flexibility through simple exercises every day. Gradually, her joint stiffness significantly decreased, and she could continue doing her favorite tasks without pain. Linda's story shows that joint stiffness is a common issue for many elderly people, but it is not something that can't be improved. When our joints begin to stiffen, we need to take proactive measures to restore flexibility and minimize pain. It's important not to wait until the condition becomes severe to take action. Linda learned that maintaining an active lifestyle and engaging in gentle exercises is an essential part of keeping the body flexible. From her story, we also realize that joint stiffness can affect our ability to perform daily tasks, but if detected and treated early, we can absolutely improve the condition. To prevent and improve joint stiffness, regular exercise is the most important factor. Stretching exercises like yoga, tai chi, or Pilates help make the body more flexible while reducing joint stiffness. Moreover, muscle strengthening exercises are also crucial because strong muscles support the joints and minimize the impact of heavy movements. Diet plays an important role in maintaining joint health. Foods rich in omega-3, such as salmon, chia seeds, and leafy greens, have excellent anti-inflammatory properties, helping to reduce swelling and joint pain. Supplementing vitamin D also helps the body absorb calcium better, promoting strong bones and maintaining joint flexibility. Finally, if you feel your joints starting to stiffen, don't hesitate to consult your doctor for early treatment. Proactive measures will help you maintain an active and healthy life. Linda's story is a great example showing that joint stiffness is not something unmanageable, but a sign to start taking better care of our bodies. With perseverance and the right methods, we can maintain flexibility and joint health throughout the years. Arthritis. Arthritis is one of the most common bone and joint problems that elderly people often encounter. It is an inflammatory condition in the joints, causing severe pain, swelling, and stiffness, making it difficult to perform simple daily tasks. Arthritis can appear in various forms, but the two most common types are rheumatoid arthritis and gout. Let's hear the story of Thomas, a 72-year-old man from the U.S. Thomas is an avid tennis player and has been active in sports since his youth. He always maintained a healthy and active lifestyle, but about 10 years ago, he started feeling pain in his hand and neck joints. Initially, he didn't pay much attention, thinking it was due to aging. However, the pain gradually worsened, accompanied by swelling and joint stiffness. One day, while playing tennis with friends, Thomas could no longer continue because of severe pain in his hand joints. He had to stop and visit the doctor. After several tests, the doctor diagnosed him with rheumatoid arthritis, an autoimmune disease where the body's immune system mistakenly attacks the joints, causing inflammation and cartilage damage. Initially, Thomas felt very sad and disappointed because he had always loved sports, and not being able to play tennis anymore made him feel like he had lost something important. However, after receiving advice from the doctor about treatment and lifestyle changes, he began attending physical therapy sessions and altered his diet. With the support of anti-inflammatory medication and gentle exercises, Thomas gradually saw improvements. He was not only able to play tennis again, but also learned how to live harmoniously with his condition. Thomas's story clearly shows that arthritis, whether rheumatoid arthritis or gout, can diminish the quality of life if not treated and managed properly. However, arthritis is not an incurable disease. Early detection and adherence to treatment methods can help control the condition and relieve pain effectively. Thomas learned that joint health care and lifestyle changes are crucial, and he could still engage in his favorite sports as long as he knew how to manage his condition. Arthritis can cause intense pain and decrease mobility, but with proper care, we can control the disease and improve quality of life. Here are some measures to prevent and treat arthritis effectively. Timely treatment. If you experience persistent joint pain or swelling, don't delay in seeing a doctor. Early detection can help treat arthritis more effectively and prevent long-term joint damage. Anti-inflammatory medications. Nonsteroidal anti-inflammatory drugs, NSAIDs, or specific rheumatoid arthritis medications can help reduce pain and swelling. However, consult a doctor to ensure correct usage and avoid side effects. Physical therapy. Physical therapy exercises can help reduce joint stiffness and strengthen the muscles surrounding the joints. These exercises will help maintain joint flexibility and reduce pain. A healthy diet. Eating a healthy diet with omega-3 rich foods like salmon, chia seeds, and leafy greens will help reduce inflammation and improve joint health. Avoid processed foods and sugary foods to prevent inflammation. Weight loss. Maintaining a healthy weight reduces pressure on the joints, especially the knees and hips, helping reduce pain and prevent further joint damage. Regular exercise. Gentle exercises like walking, swimming, or yoga can help strengthen muscles and maintain joint flexibility. Consistent exercise will help manage pain and enhance joint function. Thomas's story shows us that arthritis is not an insurmountable condition. With early diagnosis, proper treatment, and lifestyle changes, patients can live healthily and continue to engage in their favorite activities without pain. Remember, arthritis can be well managed if we proactively care for our joint health. Osteoarthritis. Next, we'll look into osteoarthritis, one of the most common joint issues among the elderly. Osteoarthritis occurs when the cartilage protecting the joints wears down over time, causing the joints to become painful, stiff, and difficult to move. It's a chronic condition, and while it doesn't directly threaten life, it can seriously affect mobility, making it difficult to perform everyday activities. Let's hear the story of Peter, a 68-year-old man from New Zealand. Peter was once a famous volleyball player in his youth. For many years, he lived an extremely active life, participating in sports and even teaching volleyball to younger generations. However, after turning 50, Peter started feeling mild pain in his knee joints whenever he engaged in sports activities. Initially, he thought it was a normal sign of aging and continued playing volleyball. But as he reached his 60s, the pain worsened. Peter could no longer engage in his favorite sports, and whenever he stood up or walked for a while, his knee joints would stiffen and become painful. One day, while playing volleyball with friends, he fell and couldn't continue because of the severe pain in his knee. After visiting the doctor, He was diagnosed with severe knee osteoarthritis, a common condition in people with a history of active sports. Since then, Peter had to face the harsh reality. He could no longer play volleyball or engage in the sports activities he loved throughout his life. He felt a deep sense of loss and sometimes frustration because exercise was such an important part of his life. Peter's story is not unique. Osteoarthritis is a natural part of aging, but if it's not detected and cared for in time, it can lead to severe consequences, affecting one's quality of life. What's notable here is that despite Peter's love for sports and his active lifestyle, neglecting the initial pains led to a more serious condition. This story shows us that failing to listen to our bodies and taking action early can lead to irreversible damage. So, how can we prevent and manage osteoarthritis? In reality, osteoarthritis cannot be completely cured, but we can control the condition and minimize its impact. One important solution is maintaining a regular exercise routine. Light exercises such as walking, swimming, or cycling can help strengthen joint health without causing further damage to cartilage. Furthermore, strengthening exercises for the muscles surrounding the joints will help reduce pressure on the joints, easing pain and preventing the condition from worsening. Moreover, maintaining a healthy weight is crucial. Every extra kilogram of body weight adds pressure to the joints, especially the knee joints, making the condition worse. A nutritious diet, especially foods rich in omega-3 like salmon, chia seeds, and green vegetables, can help reduce inflammation and support joint health. Finally, when experiencing joint pain or stiffness, don't hesitate to see a doctor for appropriate treatment. Osteoarthritis may not be fully curable, but with proper care and timely intervention, we can live healthily and minimize the effects of the disease. Peter's story serves as a reminder that listening to our bodies, detecting pain early, and taking joint health seriously are essential to maintaining an active and healthy life in later years. Osteoporosis. The first issue we need to explore is osteoporosis, one of the most common health conditions among the elderly. Osteoporosis occurs when the bones become weak, brittle, and prone to fractures. The frightening thing about this condition is that it often shows no clear symptoms until a severe bone fracture occurs, sometimes from just a minor fall. Let's listen to the story of Margaret, a 65-year-old woman from the UK. Margaret lived an active life, enjoying outdoor walks and gardening. She always felt healthy and never thought she would encounter any bone issues. However, one morning, while walking in the park, Margaret accidentally slipped and fell. What seemed like a minor fall ended up causing a hip fracture. Initially, Margaret thought it was just a mild pain that would soon heal, but after visiting the doctor, she was informed that not only did she suffer a fracture, but she also had severe osteoporosis. Margaret's story is not unique. She is not the only one facing this condition, and in fact, millions of elderly people worldwide are dealing with osteoporosis without even realizing it. Margaret's story shows us that osteoporosis can strike unexpectedly, even in those who maintain an active and healthy lifestyle. Unfortunately, osteoporosis often has no clear signs until an accident or bone fracture occurs. Early detection of osteoporosis is crucial to prevent serious consequences. To prevent osteoporosis, the first step is to ensure adequate intake of calcium and vitamin D in your diet. Calcium helps strengthen bone health, while vitamin D helps the body absorb calcium better. You can find calcium in foods like milk, cheese, seafood, and leafy greens. Vitamin D can be obtained through sunlight or supplements like fish oil. Additionally, regular exercise is an essential factor in maintaining bone density. Weight-bearing exercises such as walking, light jogging, or swimming help make bones stronger and more flexible. A consistent exercise routine will not only help prevent osteoporosis, but also improve overall health. Finally, regular bone health checkups are a must. If osteoporosis is detected early, doctors can recommend appropriate treatments to help you maintain long-term bone health. Margaret's story is not only a warning about osteoporosis, but also a reminder to all of us that bone health should be prioritized from an early age, even when we feel healthy. Proactive care and prevention of osteoporosis can allow us to enjoy an active and healthy life in the years to come. Fracture risk. Finally, one serious issue that elderly people often face is the risk of fractures. When bones become weak and brittle, especially in those with osteoporosis, even a minor fall can lead to severe fractures. These accidents can happen anytime and not always easy to recognize the potential dangers until the incident occurs. Let's listen to the story of Elaine, a 74-year-old woman from Scotland. Elaine lived a very active life, enjoying hiking and gardening. She was always proud of her ability to maintain her health and energy even as she aged. However, one day, while walking on the sidewalk near her home, Elaine tripped on a small stone and fell to the ground. What seemed like a harmless fall, but when she stood up, she felt a sharp pain in her right leg. She thought it was just a minor bump and tried to stand, but after seeing the doctor, she discovered that she had fractured her hip. Elaine underwent surgery and a lengthy recovery process. The recovery was not easy, and she faced a sense of loss when she could no longer participate in the activities she loved. After consulting with her doctor, she realized that the fall wasn't just a coincidence. The main cause was osteoporosis, which had made her bones weak and brittle. Since then, Elaine began learning more about osteoporosis and preventive measures. She realized that even though she could maintain an active lifestyle, neglecting proper bone health care could lead to serious accidents. Elaine's story reminds us that when bones become weak, the risk of fractures significantly increases, especially for the elderly. A fall that seems harmless can result in serious consequences. This is a warning to start caring for your bones early and realize that osteoporosis is not a problem to ignore. The risk of fractures can happen at any time, and when bones are no longer strong, things that seem simple can cause major injuries. To reduce the risk of fractures, it's important to maintain a diet rich in calcium and vitamin D. Calcium helps strengthen bones, while vitamin D helps the body absorb calcium more efficiently. You can find calcium in foods like milk, cheese, seafood, and leafy greens, while vitamin D can be supplemented through sunlight or supplements. Moreover, regular exercise is essential for bone protection. Weight-bearing exercises such as walking, light jogging, or swimming will help increase bone density and maintain muscle strength around the joints, reducing the risk of injury from falls. An important factor in reducing fall and fracture risk is improving balance. Exercises like yoga, tai chi, or even simple daily walks will help maintain your balance, thus reducing the chance of falling. Additionally, using assistive devices like walking sticks or walkers can help you feel more secure, especially in uneven areas. Finally, if you have any signs of osteoporosis, visit your doctor for early screening and treatment. Early detection will allow you to take preventive measures and effective treatments, protecting bone health in the years to come. Elaine's story is a strong reminder that taking care of bones is not just important, but it can change our lives. Start today to protect your bones for a healthy and active future.